Hello, hello, hello. Assalamu alaikum. Today is a day of psychiatry. Today is a day of psychiatry. I would like to talk on some topics regarding psychiatry because I actually forget those topics now and then, and psychiatry is some sort of my weak point. I think so. Okay, before jumping into the hard topic, like to talk about some important figures, some important thoughts of psychiatry. First of all, uh, panic disorder month is near about 1 month. Phobia is month. Panic is 1 month. Phobia is 6 months. General anxiety disorder is more than 6 months. MDD, major depressive disorder, is more than 2 weeks, and mania is more than 1 week. Bipolar 1 in bipolar 1, one or more than one manic, so without hypomanic or depressive. Bipolar 2, a hypomanic and a depressive. Cyclothymic is more than 2 years, not more than 2 months without bipolar symptoms. More than 2 years with not more than 2 months of bipolar symptoms. Dysthymic, also known as persistent depressive disorder, persistent depressive disorder, or two or more than two depressive symptoms lasting more than 2 years, two or more than two depressive symptoms lasting more than 2 years, or more than depressive symptom lasting more than 2 years. And dig fast, three or more than three symptoms lasting more than 1 week is mania. Five or more than five symptoms lasting more than weeks is depression. In schizophrenia spectrum disorder, brief psychotic disorder is one. Brief psychotic disorder is one positive symptom between 1 to 1 month. Schizophrenia form two or more positive symptoms, two or more than two positive symptoms lasting more than 1 to 6 months. And schizophrenia is more than 6 months. Schizophrenia is more than 6. In schizoaffective disorder, this one, it shares symptoms with both schizophrenia and mood disorder. It shared the symptom with schizophrenia to differentiate from mood disorder with psychotic feature. Patient must have 2 weeks of psychotic symptom if the patient 2 weeks of psychotic symptom but no manic or depressive episode. This is schizoaffective disorder, two or more than two psychotic feature but no mania or depressive symptom. This is schizoaffective disorder. In delusional disorder, one or more than one delusion lasting more than 1 month. One or more than one delusion lasting more than 1 month, but without a mood disorder or psychotic symptom, but without a mood disorder or a psychotic symptom, without a mood disorder or a psychotic symptom. This is delusional disorder. Delusional disorder. Okay. Learning is an art, and diagnosis is another art. To learn this art, you have to master in the art. To be the master in the art, to be the master of the diagnosis, all you have to do is to think. It's, all you have to do is to think. It's to assess the pain in the patient. It's to assess the pain in the patient. A very, very bad person. I think so. Okay, let's drop this matter and go through question again and again and again. This is antisocial personality disorder. I will diagnose age more than 18, and do some work which violates the social norm. Like a 21-year-old man comes to the emergency department due to injury sustained during a fight. He has broken nose and requires stitches for scalp and arm laceration. His girlfriend says we are having a beer. We were having a beer when he got angry and paranoid about the way about the way I was looking at me. We are not allowed to go back to the bar again because he started so many fights there. The patient says the other guy looks much worse than I do, uh, but he had it coming. The patient had multiple jobs in the past year and was recently fired from his sales job for repeated absence. He says that job was beneath me. The job was beneath me. I can easily make more money doing something else. Taking in the middle of the school. Mm, the patient has repeated suspension for truancy and fighting. He blames his failure to be accepted into the college, failure to be accepted into the college on the teacher who reported this. Mm, so he has done something. The patient is reckless disregard safety of self and others, unstable employment history, lack of remorse are suggestive of antisocial personality disorder. Antisocial personality disorder is a lifelong disorder characterized by pervasive pattern of disregard for and violation of the rights of the others. Beginning in the childhood, early adolescence, continuing in adulthood, age more than record for age more than 18 require an essence of feature con- evidence of conduct disorder prior to age 15. This patient's history of tra- transcend fighting from middle school onward. Individual with antisocial personality disorder tend to be physically aggressive and impulsive and may readily get into fights. Additional typical behaviors include illegal activities, illicit drug use, theft, lying, manipulation of other personal gain, the patient's arrogant self-appraisal, lack of remorse, and failure to accept responsibility for his own behavior. Blaming teachers for not getting into the college and are characteristics of antisocial personality disorder. The patient was prescribed Fluoxetine 2 weeks ago due to symptoms of the depressed mood and speech. But her depression began improving 2 days after starting it. 2 days after starting, she says that I have never felt better. I'm so glad I had taken the patient's sleeping 4 hours a night, but reports that her energy is excellent. She says that she's figuring out doing best savings. Mm, mental status is remarkable for rapid speech. Patient has no suicidal ideation, delusion, hallucination. Next step, discontinue fluoxetine. This is antidepressant-induced hypomania. All antidepressants carry the risk of hypomania, or all antidepressants carry the risk of hypomania or mania, and medication-induced switch to hypomania may suggest an underlying bipolar disorder. In addition, atypical rapid improvement of depression after antidepressant initiation as in patients improvement after 2 days, as in patients improvement after 2 days compared to the typical 2 weeks, is an additional sign that she may have an underlying bipolar spectrum disorder. The causative agent must be stopped in antidepressant-induced hypomania. Antidepressants are usually tapered slowly to prevent antidepressants are usually tapered slowly to prevent antidepressant discontinuation. Antidepressant discontinuation syndrome, fluoxetine's long half-life makes these less a concern. However, patients with precipitated hypomania require immediate discontinuation of antidepressant to avoid further worsening of the condition, and then a life-altering financial ruin, sexual indiscretion, hospitalization after stopping oxygen. The patient should be followed of the symptom. If hypomanic symptom persists despite discontinuing the antidepressant, if hypomanic symptom persists despite discontinuing the antidepressant treatment with a mood stabilizer, lithium valproate, or an antipsychotic should be considered. Kleptomania, stealing, urge to steal something. Kleptomania, impulse control disorder, typical adolescents. Like this 16-year-old boy comes to the office due to crippling anxiety. The patient recently quit his job at a local convenience store due to anxiety. He has an uncontrollable urge to take keychains, one of the displays. Once in the evening, as the patient was closing the store, he acted on impulse. He acted on this impulse and felt better. However, he felt guilty and could not sleep. The next morning, he returned the keychain before anyone noticed. Over the next few weeks, the patient had increasing breakfast. Mm, After three more instances of taking kitchen and returning them, he stopped going to work because the manager. He liked the manager. He liked the manager and was afraid of getting caught. He has otherwise been attending schools. Has otherwise been attending schools also regularly. So it is a kleptomania, repetitive impulse to steal is likely to kleptomania. Impulse control disorder is the typical onset in adolescence. These individuals experience impulses to steal objects of low monetary value or not needed for personal use. In contrast, typical shoplifters steal for personal gain and their acts are easily premeditated. Their acts are easily premeditated. In kleptomania, overwhelming anxiety and tension precedes impulse and is relieved. The theft, guilt, and shame typically follow. So these may return or give away stolen items. 4-year-old boy is brought to the office due to language difficulty and concerns and intellectual development. He can recognize a circle and color of hue, and the colors yellow and red, but struggles to name other shapes and colors. During examination, the patient sits in the corner, lining up cards. When, when, when his mother attempts to divert his attention, he has a temper tantrum and begins to bite his hand. This is autism. What is not less than although this patient engages in hand biting and temporary display, other characteristics of the lesion and light spasticity, breathing movements, dystonia, nephrolithiasis, or gout. In autism spectrum disorder, social deficits with onset in early development, restricted repetitive behaviors and interests, with original language delay and cognitive impairment. Management behavioral speech or occupational therapy, evaluation, comprehensive clinical evaluation, genetic testing, chromosomal microarray, fragile X gene analysis, brain MRI, macrocephaly, and neurologic deficit. Brain MRI, macrocephaly, and neurologic deficit. The before-year-old women, emergency department, sudden onset blurry vision, intermittent numbness and tingling in the legs or past several weeks. The patient has under stress at school and is struggling to complete assignment on time. The patient's medical history is significant lectures in marine companies that occurred 8 months apart and are episodes of unilateral blindness and episodes of unilateral blindness that occurred after waking up bro- with her boyfriend last week. And an episodes of unilateral blindness that occurred that occurred after waking up with her boyfriend last week. With each instance, with each instance, our symptoms resolve spontaneously over the several days without treatment. The patient has no other medical or psychiatric history. Brain MRI shows multifocal blood pressure, hyperintensity imaging, multifocal head matter, hyperintensity imaging in the corpus callosum and the periventricular area, the corpus callosum and periventricular area. Patient most likely to develop which of the following condition. This is the question. So patient history of two clinically distinct episodes of CNS with visibility and hypervigilance vision and MRI consistent with multiple sclerosis. MS occurs commonly aged 15 to 50. The common autoimmune demyelinating disease is characterized by a relapsing remitting course of CNS dysfunction. Relapses of MS may be more common after stressful life. Depression has been found in up to two-thirds of the patients with MS. Depression has been found after two-thirds of the patients. MS, the most common psychiatric complication, the most common psychiatric complication. Depression can occur at any diagnosis, likely caused by a combination of factors including inflammatory changes in the brain, immune system changes, and psychological reactions to harm deficits and challenge of living with illness. Depression in parents is commonly underdiagnosed depression in illness is commonly underdiagnosed and underrated. Appropriate treatment including psychotherapy and antidepressant can alleviate suffering and improve quality of life. Major depressive disorder, SSRI, SNRI can be given. The patients highly recovered and severe episodes, five or previous major depressive episodes and suicide had appropriate candidate for maintaining antidepressant pharmacotherapy. Recover major depression in the concept of illness. This is reactive attachment disorder. 4-year-old girl walked to the office. An adopted mother, she was placed in a foster care and she was placed in foster care at age 2 prenatally due parental substance use due to parental substance use disorder and was adopted by her family 6 months ago. The mother says she does not like being hugged or picked up. Nothing I do seems to me what it seems to be.